So today we are going to learn about the care of a newborn calf. So well before the cow parturites, you must know about how to take care of the newborn calf. So first thing, after the parturition, that means after the giving birth of the calf, first thing to do is arrange a piece of clean cloth to wipe the calf's body. Then see that the umbilical cord is cut properly and some tincture iodine is applied on the umbilical cord. This is to prevent any further infections to the cord. So after this, again you should look for the nostrils and the mouth of the calf to make sure that no mucus remains there, so that it is easy for the calf to breathe. So suppose if the breathing is not proper in a newborn calf, what are we going to do? Yeah, we must clean the nostrils and the mouth with a piece of cloth, that is there. But one more step is to be done, where you can use a piece of straw or a piece of grass to be put into the nostrils of the calf to remove any piece of mucus from the nostril, so that the calf starts breathing normally. Then next step in the preparation, in the making ready this calf to live a normal life, making it healthy enough for a good start, is to rub the body of the calf as soon as in the initial years of its birth, so that it gets active. Half of this work will be done by the mother, that we have seen, and you can even look for pressing up of the chest as well as the body down to trigger any kind of good level of respiration in the calf. Another next step is to within the first few hours of its birth, next step is to attempt colostrum feeding for the calf. We know colostrum is a very important gift of the nature, where mother is supplying good amount of nutrients to the calf. It has immunoglobulins in it, which will give enough immunity to the calf. So that is very essential. Within half an hour after the birth, the calf should be given colostrum. If it is given late, the absorption of these immunoglobulins into the calf's body from the colostrum will reduce. That is, the intestine will have a lesser ability to absorb these immunoglobulins from the colostrum. So we must take care that within half an hour of the birth of the calf, we must feed enough colostrum, and it should be continued for the next 4 to 5 days. Yeah. And the rate of feeding of colostrum is very important, 10% of the body weight of the calf at the time of birth. Okay. So we must also remember the advantages of colostrum feeding, where colostrum is containing antibodies or immunoglobulins which provide immunity, which is essential for the disease resistance of the calf, and also it even contains carbohydrates, proteins, vitamins and minerals. It will also help the first expulsion of the feces, which is known as meconium.
Just wanted to talk something about calf management. This is basically a livestock farm. Livestock, it's a living thing which we are dealing with. So always make sure you're dealing with care. They give us a lot of production, so even we have to be careful when we are handling them, especially the young ones. Dehydration and cold weather are major killers. So we have to make sure that they are warm after they are detached from their mother. And the pen also should be clean. Deworming also should be done regularly. Proper bedding should be provided. Proper feeding should happen. And people should be assigned to take care of them. If the calf is not eating, not drinking, there is loose motion, any change in their life pattern has to be immediately reported to the concerned vet, and immediate action can be taken and mortality can be avoided. Another thing, as a doctor and as human beings, you have to show humanity to them. Because no kicking, no hitting, no pushing. We have to take care of them.